What if one of the biggest lies that people believe is this? Cancer just happens. There is nothing I can do. Picture this: a mother raising her children, a father working hard for his family. A young adult feels healthy, strong, and full of plans. Life looks normal, but quietly, everyday choices may be shaping tomorrow's risk. Smoking, too much alcohol, excess weight, too little movement, missed vaccines, missed screenings, too much sun, and ignored warning signs. This is why this message matters, because cancer is serious, but cancer does not come randomly. The World Health Organization says that cancers can be prevented through evidence-based actions. So let's look at, can cancer be prevented, and what must you know? I'm Dr. Joshua Derito, a family physician. I have interest in cancer prevention and public health. In this channel, we break complex science into simple actions that you can use today, because action is what makes a difference. And that is what changes everything. The truth about cancer prevention. Let us be very clear from the beginning. Not every cancer that can be prevented, but some cancers still happen even when people who have lived healthy lives. But cancers are linked to many risks that we can reduce. And that means prevention is not about panic. It is about wisdom. It is about action. It is about giving yourself and your family the best possible outcome. What are some of the things that raises your cancer risk? Some of the biggest preventable risks for cancer include tobacco use, alcohol use excessively, excess body weight, physical inactivity, infections that can lead to cancer like HIV, hepatitis B and C, human papilloma virus infection, too much exposure to ultraviolet radiation, and also air pollution, and then some environmental exposures. And here is what makes this dangerous. These risks do not look dramatic. Nothing outrageous, nothing abnormal. Sometimes they look ordinary. A cigarette, years of sitting too much alcohol, weight slowly growing up, skipping your vaccines and nothing happens, skipping your screenings, too much sun without protection. Small risk, repeated over time, can grow into major consequences. And that's what makes the difference. Tobacco is one of the biggest dangers. If there is one message to remember, is this: avoid tobacco. Smoking is one of the biggest causes of preventable causes of cancer. And it does not only affect the lungs, it raises the risk of many other cancers. So if someone is smoking today, stopping is not just a lifestyle decision. It is a powerful cancer prevention step. Your weight, your food, and your movement matter. Cancer prevention is not about smoking only. Your body weight matters. 13 cancers are associated with being overweight or having obesity. This is not rumor-mongering. It is not fear-mongering. It is the reality. Movement matters. Sitting too much increases your risk of getting obesity and overweight. Food choices matter what you eat. This is not about chasing a perfect body. It is about protecting your body to carry you in the next 10, 20, and 30 years of life with a healthy body. The more we care for our bodies now, the more we protect our future. Alcohol raises the risk of getting cancer. Many people do not realize this, but alcohol is also a cancer risk factor. Alcohol causes liver cirrhosis. Liver cirrhosis can get you into liver cancer. So the idea of alcohol being harmless is not accurate. Less alcohol means less risk. That is the truth people need to hear. Some cancers can be prevented with some vaccines. Yes, that is the truth. This is one of the most hopeful part of this message. Some infection can lead to cancer, and some of those infections can be prevented. Vaccines against human papillomavirus, which the vaccine is being now offered to young boys and girls to prevent them from getting the human papillomavirus vaccines. So make sure that the youngsters are vaccinated. Vaccination against hepatitis B. Now hepatitis B vaccination forms part of the HPV immunization schedule. So make sure that your child is fully immunized. And think about this. Cancer prevention can start before, far long ago, before cancer appears, with the vaccines and early action. So, with protection comes damage prevention. Cervical cancer can be prevented, and it has shown to work. One of the clearest examples is cervical cancer. Cervical cancer is largely preventable through human papillomavirus vaccination, regular screening. Cervical cancer can be detected 10 years earlier before the ovarian disease presents. And this you can do. And you only need to do the FIA, a 5-minute test, protects you for 5 years. You repeat it another 5 years. And this gives you freedom. Unfortunately, in Africa and in Kenya, so many ladies are succumbing to cervical cancer. Have you done your cervical cancer test in the last 5 years? What this means, prevention is real, it works, and it saves lives. Screening is more powerful than people tend to think. Many people think that screening means finding cancers early. But sometimes screening can help prevent cancer by finding problems before they become cancer. That is why screening matters too much. Do not wait for fear. Do not wait for pain. Do not wait for symptoms to force you to act. Act early. Screening is one way of protecting tomorrow before tomorrow becomes a crisis. If prevention is this good, if screening is this beneficial, why do people delay? Many people say, I feel fine, there's no cancer in my family, I'm still feel young, I'll do it later, I do not have time. But cancer does not always announce itself early. That is why delay is dangerous. The loss can be health, can be time, can be peace of mind, can be money, can be years with the people you love. But the gain of acting early is so real. Lower risk, early detection, more treatment options, more healthier years ahead. What should you do starting today? Start here. Do not smoke. Limit your alcohol intake. Keep a healthy weight. Move your body regularly. Protect your skin from too much sun. Keep up with the vaccines like the human papillomavirus and the hepatitis B vaccine when appropriate. Go for the recommended screening. Do not ignore unusual symptoms. You do not have to do everything in one day, but you need to start. One better choice, then another, then another. That is how prevention works. This becomes your habit and you prevent cancer risk by action. Can cancer be prevented? Many cancers can, not all, but many. This message is not about fear. It is about power. The power to stop smoking, the power to move more, the power to drink less, the power to vaccinate, the power to screen early, the power to act before regret. Protect your body now. Protect your family now. Protect your future now. If you want personalized guidance on cancer prevention, lifestyle risk reduction or screening, even early evaluation, visit Wellness Health Services Medical Center for compassionate expert care. The best time to reduce the risk is before the disease begins. Thank you for watching. Share this video with someone you love. We meet in the next video.